Hello and welcome to Pregnancy Info. Today we will discuss the causes of spotting and bleeding during pregnancy. Noticing spotting or bleeding during pregnancy can feel terrifying, but it isn't always a sign that something is wrong. Many people who spot during pregnancy go on to deliver a healthy baby. Spotting is when you see a light or trace amount of pink, red or dark brown blood. You may notice spotting when you use the restroom or see a few drops of blood on your underwear. It will be lighter than your menstrual period and there is not enough blood to cover a panty line. During pregnancy, several factors can result in spotting and most of the time baby is perfectly fine. What does vaginal bleeding during pregnancy look like? Bleeding during pregnancy can look different for everyone. Your healthcare provider will want to know what your blood looks like so that he can evaluate your symptoms. Some details you will want to track include the color of your blood. Your blood might be brown, pink or bright red. The consistency of your blood. Is it smooth, thick or watery? Does it contain clots? How much blood there is? Did you see a few drops or you feeling a pad? Here we will discuss 16 causes of such kind of spotting or bleeding during early or later pregnancy. Number 1. Implantation bleeding. In early pregnancy, you might get some harmless light bleeding called spotting. This is when the developing embryo plants itself in the wall of your womb. This type of bleeding often happens around the time your period would have been due. Cervical changes. Pregnancy can cause changes to the cervix and this may sometimes cause bleeding after sex, for example. Miscarriage. If a pregnancy ends before the 24th week, it's called a miscarriage. Around 1 to 5 pregnancy ends this way. Many early pregnancies end with miscarriages because there is something wrong with the baby. There can also be other causes of miscarriage such as hormone or blood clotting problems. Its symptoms can be cramping and pain in your lower abdomen, a discharge of fluid from your vagina, a discharge of tissue from your vagina, no longer experiencing the symptoms of pregnancy such as feeling sick and spotting or bleeding. Ectopic pregnancy is another cause. An ectopic pregnancy is when a fertilized egg implants outside the womb, for example in the fallopian tube. It can cause bleeding and is dangerous because the fertilized egg cannot develop properly outside the womb. The egg has to be removed, which can be done through an operation or with medicines. Symptoms must include tummy pain, low down which may be on one side, vaginal bleeding or a brown watery discharge, pain in the tip of your shoulder, discomfort when peeing or pooing. Molar pregnancy, a rare condition when a fertilized egg implant on your uterus but a tumor form instead of a fetus. Low-lying placenta or Preterm Previa. This is when the placenta is attached to the lower part of the womb, near to or covering the cervix. Bleeding from a low-lying placenta can be very heavy and put you and your baby at risk. You may be advised to go into hospital for emergency treatment and a cesarean section will usually be recommended. Vasa Previa. This is a rare condition where the baby's blood vessels run through the membranes covering the cervix. When your water breaks, these vessels may be torn and cause vaginal bleeding. The baby can lose a life-threatening amount of blood. Subchorionic hematoma. Bleeding from one of the membranes that surround embryo inside your uterus. Subchorionic hematoma usually resolve on their own. Cervical polyps, a non-cancerous growth on your cervix that bleeds in pregnancy due to increased estrogen level. Placental abruption, a rare condition where the placenta detaches from the walls of the uterus. This can be dangerous for both you and your fetus. Preterm labor, going into labor earlier than 37 weeks of pregnancy. Other symptoms of preterm labor are contraction, cramping or other membrane ruptures. Incompetent cervix, when the cervix opens too early and causes premature labor. Sex. Some women experience light bleeding after sex. This is due to your cervix being extra tender during pregnancy due to pregnancy hormones. Pelvic exam or ultrasound. Your cervix can bleed after a pelvic exam or transvaginal ultrasound because it's highly sensitive. Infection. Chlamydia, gonorrhea, and other sexually transmitted infections or urinary tract infection can cause light bleeding. This infection will need to be treated by your healthcare provider. Bloody show. This is when the plug of mucus that has been in the cervix during pregnancy come away, signaling that the cervix is getting ready for a labor to start. It may happen a few days before contractions start or during labor itself. Here are some treatments for vaginal bleeding during pregnancy that you can do: relaxing and staying off your feet, avoiding sex, avoiding traveling, bed rest, hospitalization or surgery if the bleeding is severe, getting plenty of rest, using pads rather than tampons while you are bleeding, avoiding sex when you are bleeding. Sex can resume once the bleeding has stopped, taking mild pain relief medications such as paracetamol if needed, reporting any changes in your condition to your doctor. In the end, we must say that don't be stressed, because stress can cause bleeding, spotting, and it can also lead to miscarriage. So be relaxed and believe in God. Take care.